Now, throughout the pandemic, intensive care has been a part of the NHS which has been under the most consistent pressure. Now, doctors are warning that some staff simply don't want to come back to work because of the huge demands being placed on them. Well, Dr. Shondipon Laha, who's an intensive care consultant, is also Honorary Secretary of the Intensive Care Society, joins us now. You've described it as being a little bit like working in a war zone. Just tell us what the daily grind is like at the moment for those in intensive care.
Hi, good morning, Jane. First of all, this has been going on for about 10 months now. So we've been seeing increased numbers of patients coming in over a variety of ages, many of them in their 40s, 50s, 60s, who were previously fit and well, who are incredibly sick. Intensive care units across the country have been doubled in numbers. So the number of normal beds that they had a year ago, they've been running at twice that for several months. Of course, we don't have those kind of staffing available, so we've had to redeploy staff from other areas. And current staff have been working extras when they're meant to be resting or when they're meant to be on holiday. And on top of that, we've seen a significant rise in the number of people being off sick. And a lot of that is just due to the pressure of the work.
Because often these staff won't necessarily be intensive care staff, so they're being put in an environment which is a great deal more stressful than they're used to, at a time when it's even more stressful than it normally would be.
Absolutely. And what we're also finding is that many intensive care units, there are a lot of patients turning up that would normally be treated on intensive care, but are having the same treatments outside of intensive care, and the respiratory doctors and the acute physicians are all having to look after those patients. So the nurses in those areas who are having to be trained up to use them in very, very rapid time, understandably, feeling under pressure. So across the country, we're seeing staff are getting to the point now where they're really thinking, how much longer do we have to do this for?
What kind of stuff are you having to do for patients? Because at the end of their lives, they'd obviously hope to have their loved ones around them, and that's just not possible because of COVID.
Absolutely. So what normally happens is the families have been visiting patients, and if we feel that they aren't likely to survive, we will call the families in, go and sit down, chat to them, make sure that they have nursing staff that they may well have become quite friendly with, to comfort them as well, and then they can go in and sit with their loved one and watch them pass away. Now, this time round, the last thing many families will remember is seeing their loved one being bundled away in the back of an ambulance, and us giving daily updates on what's going on. But the interventions we do on intensive care are very challenging to actually visualise. And so often we find ourselves having to have that conversation at the end of life. Quite often places will allow families to come in at that point. But again, if a family is having to isolate, then that's not a viable option. And many of them live too remote to be able to do that. That we find ourselves taking the place of those families and ensuring the patient's wishes regarding how they pass away are followed.
So that's in terms of just actually physically being there, maybe playing music,
Yeah.
maybe just them knowing that they're not alone.
Yeah, so I've had colleagues take in beer, for example. I've had colleagues play guitar. Whatever we can do that is within our capacity, we will do. Often it's putting the family on FaceTime and allowing them to be able to converse, or even just look at the patient passing away in the hope that that gives some sort of demonstrates their love for them.
I mean, having to break the news to a family that their loved one is about to pass away must be absolutely the hardest and worst part of your job. How many times a day are you having to do it?
Well, I think normally we'd probably do it maybe once a day. And over the last few months, maybe anywhere up to 2-3 times a day. It becomes it's very emotionally draining for everyone involved, and it's very difficult to keep doing that.
I mean, the families obviously must express their gratitude. Do you feel their gratitude from them and the rest of the population for what you guys are doing? It's truly extraordinary.
Yes, I think the families definitely know and do thank us afterwards. Again, sometimes it's very hard to understand what's happening, so sometimes it can be very frustrating for both sides. And the public as well, on the whole, they do show gratitude for what's going on. And they do honour our requests to stay away from the hospital, first of all, because we don't want to encourage people who've been isolating to spread the disease. But it's very frustrating for them to not be able to visit, for example. And I know a lot of families really struggle with that, and I'm very grateful that they can follow the rules.
And just briefly, how do you cope? How do you decompress? Who do you go to at the end of a horrific day?
Well, it's always your family. I find it very difficult to decompress, but I've got 3 children, and my wife spends most of her time when she's not operating. She's a surgeon, basically corralling my children into quiet areas to allow me a bit of time. But they're all being homeschooled at the moment. I watch the football. I follow Manchester United. I've got a guitar that I play very badly, but it's those kind of things. It's the small things that you take comfort in. Play with your children, build Lego with them, watch films. But the difference between I know I've described it as being in a war zone occasionally. It's different to being in a war zone, because in a war zone you go away for several months and then you come back and you anticipate prolonged periods of peace. In this, you go to a very highly stressed environment where you're making decisions that have repercussions if you get them wrong for 12-15 hours, and then you come home where that stimulation isn't there, and it's very hard to turn on, turn off. And I think a lot of my colleagues that we're seeing really struggle with that kind of intermittent overload and then come home again.
Dr. Shondipon Laha, we're going to have to leave it there, I'm afraid, but we're really grateful for you for coming on this morning and talking to us, and indeed grateful for all that you and your colleagues are doing for so many families. Thanks a lot.